My name's Jess. I'm going to be your nurse today. I just want to say hi and get your name and first and last name and your date of birth.
Mary Johnson, 9/22/93.
Perfect. I'm just going to wash my hands quick and then double check her patient ID, and she is who she says she is. We're going to close the curtain. Get her a little bit more close here. All right. Just going to put some of my stuff to the side. So right off the bat, I'm actually looking at the patient's skin color. It's on her symmetry of her face. I don't see any masses or lesions. Can you tell me what time it is of the day?
About 3 p.m.
Okay. How about the date?
It is 2/21/2020
Okay, perfect. And where are we right now?
at Mayo Health Clinic System.
Perfect. All right. So again, I'm just analyzing kind of the skin. We're going to go through a head-to-toe assessment. So at any point, if you have questions or you have any pain related to what I'm asking you, just let me know.
Okay.
So I don't see, again, any asymmetry or masses or lesions. Do you know about any open areas on your face, neck, anything like that?
No.
Good. I'm going to start second by just kind of analyzing the configuration of the skull, and it is proportional to the rest of the size of her body. I'm actually analyzing her hair now. The distribution is good. It looks healthy. I don't see anything on the scalp that indicates that there might be infestation or dandruff or dryness. I'm going to wash my hands here again, and I'm just going to kind of look through your hair here just to make sure, okay?
Okay.
So I'm palpating her scalp, looking through her hair. Distribution is still normal. Again, no infestation. Things are looking good. I'm going to check the back, any pressure points to make sure there's no open areas, and that looks good as well. All right, and then we're going to move on. Let me just put my stuff away here quick. All right. I have what we have here is, are you okay if I use this on?
Mm-hmm.
Yeah, okay. So we're going to move on just to kind of your face. First off, I'm going to have you clench your teeth together. Good. And smile with your lips tight. Good. Can you close your eyes? Puff out your cheeks. And stick your tongue out. And move it side to side. Good. Next one, I'm going to have you go up against my hands with your shoulders. Good. Can you struggle like that? Good. I'm going to just test your sensation. So this is just a Q-tip. I'm going to do in a couple different areas, and I just want you to tell me if you can feel what I'm doing.
Okay. Yep.
Good.
Yep.
Good. Good. All right. Next, I'm going to move on to her ears externally. They look good. They're symmetrical. When I look at the other one, they're both symmetrical on her face and proportional. I don't see any masses, lesions, open areas. The color is good. It's shiny and pink. I'm going to palpate here. Any pain with that?
No.
Good. All right. I'm going to move on to the nose now. Do you have any drainage or sneezing that you know of?
No.
Or haven't been experiencing anything?
Mm-hmm.
Okay. Any sinus issues?
Mm-hmm.
Good. So first, I'm going to get my pen light, but I want to make sure that you're not having any pain around your nose or your sinuses.
Okay.
So I don't see any inflammation. You haven't had any sinus inflammation that you're aware of?
No.
Okay. Can I have you just take off your glasses for a minute? I'm just going to kind of palpate around and just let me know if there's any pain. Anything?
No.
Anything?
No.
Nothing?
No pain.
Good. Okay. I'm going to just take a quick peek. I don't see anything, any polyps or masses. And you haven't had any trouble with shortness of breath or breathing?
No.
I'm going to have you plug one nostril, and I just want you to breathe through the other one. Okay, and that's patent. And let's do the other.
Okay.
Very good. Okay, so next we're going to just look at your eyes. So first off, I'm just kind of looking at the symmetry. They are symmetrical. I don't see anything with the eyelids or the folds. I don't see any swelling. I don't see anything like that. They look great. Next thing I'm going to kind of look through is just the iris and the pupils. The pupils look equal. I don't see a drift. I don't see any nystagmus or diplopia or lazy. So I'm going to just kind of shine a light in your eye.
Okay.
Sorry, I'm being awkward.
You're fine.
Good. And pupils are both equal and reactive to light. Now I'm going to check your accommodation. So first I just want you to keep your eyes on this. I'm going to start close. Anything you still see?
Yep.
And I'm seeing her eyes accommodate. Good. Next I'm gonna check your vision, so your fields. So I'm just gonna kinda have you follow, keep your head straight and to the front,
Mhm.
and just follow with your eyes.
Okay.
Good. Okay. Visual fields are intact. I'm gonna have you just open your eyes real wide for me again. Now I'm just kind of looking at the sclera and the pupils and the iris, and I don't see any problems there. I'm just gonna pull down a little bit. Conjunctiva is intact. There's no erythema. I don't see any jaundice. So any blurry vision at all that you've been noticing? Any pain or discharge?
Nope.
Okay. At this point, I would have her do the Rosenbaum test and have her stand about 10 feet away from the chart. One being reading the lines until she can no longer, so I can get a visual acuity. And then next, I would identify both right and left eye to make sure it's more accurate. Since we don't have that today, I'm going to walk through it, or have walked through it, and we'll move on. So after that, we're going to just kind of look in your mouth. Have you had any taste problems lately?
Mm-mm.
Okay. So I'm going to have you clench your teeth real tight for me again. Good. And then open and say ah. Good. Lips are intact. They're not dry. I'm going to look in there. I don't see any discoloration of the tongue. I see the soft palate, the buccal muscles. Now I'm going to have you kind of stick out your tongue and then up. Good. Good. So the top and the bottom of her tongue are both intact. I don't see any discoloration. I'm going to have you say ah again. Good. And soft palate rises when I do that. At this point, if I had a tongue blade, I would put it in her mouth and test for a gag reflex. But since her soft palate's rising, and I do see her uvula and tonsils are midline, I'm not going to do that. Everything else looks intact, and I am able to visualize. There's no swelling, there's no lesions, there's no masses. So, good. So we're going to move on to the neck now. So I'm going to first off just look and make sure everything's symmetrical. You haven't had any pain at all that you're noticing?
No pain.
Good. Okay. I'm just going to come over here, please. Let's see. All right. So first off, I'm just looking back, front, and side to side. I don't see anything wrong. It's symmetrical. There's no swelling. Next, oops. Sorry. I'm going to have you just move your head from side to side. Any pain with that?
No pain.
Good. Up and down.
No pain.
Good. And then can you do it from right to left? Good. So I'm just going to palpate here now. Let me know if there's any tenderness.
Okay.
Good. Good. And while I'm doing the neck, I'm going to actually look for your lymph nodes. So we're going to do pre-auricle, post, and down the jawline. Any pain with that?
No.
Good. Good. A little further. You don't feel any swelling or any distension in that. You said no pain when I'm touching or
No
swallowing.
pain.
Good. Next, I'm just going to palpate for any tracheal deviation. And I have you swallow. Trachea is midline. I'm also feeling for the thyroid. Can you swallow one more time? Any problems with that? No. Good. While I'm feeling, I'm going to check for one carotid pulse. And that's intact and +2. And then the other. Intact and +2. Great. Let me just get some other stuff here. So next, I'm just going to kind of test your range of motion. Kind of similar to what we just did before. So I'm going to have you resist or meet my resistance. Okay. So if you want to go ahead and put your chin down. Good. And then put your head up. Good. And then side to side. Very good. All right, no pain with that?
No pain.
All right, perfect. Let me grab my other stuff here again. I think we're pretty much good with that. The only thing is I'm going to just take a really quick listen. And this is just going to be listening for your carotid, if there's any bruise, and if there's any issues when you're swallowing with your thyroid.
Okay.
That sounds great. Perfect. All right. Next, we're going to go to your upper extremities. So I would like to do this on a patient with who's not wearing long sleeves so I can see, but is there any pain or anything that you're having right now?
No pain.
Good. So I would inspect the skin right off the bat. I would be looking for hair distribution, muscle mass, muscle symmetry, muscle tone, any swelling in the joints, and if I don't see anything abnormal, I would move on to palpation. So first I'm just going to kind of feel, just kind of your hands, anything hurt when I'm touching in your joints?
No.
Good. Good. And since we're doing this, I'm just going to make sure range of motion is okay. Nothing like that hurts?
No.
Good. I don't feel any clicking. Nothing like that hurts?
No.
Good. Do it over here. Nothing? Oh, good. Good. Okay, I'm gonna have you squeeze my fingers.
Okay.
Okay. Strength is equal throughout or in your hands. Can I have you clench your fists and wiggle? Any numbness or tingling?
Nope.
Good. I'm gonna have you meet my resistance, kind of like we did here with your neck. I'm gonna push out, you push in.
Okay.
Good. And then opposite. Perfect. Okay. While I'm doing that, I would kind of look at the shoulders and I would look at the scapula before moving on. I'm gonna feel for a pulse. Good. And another. Brachial. Good. Okay. Let me get my stuff here quick. Alright, so arms are okay. We're going to move down to the front and the back of the chest. I would also do this on a bare skin, but for today's purposes, we'll keep the gown on. Again, first off, looking for symmetry and any masses, any pain, anything like that. Looking for the skin if it's sweaty or pale. In this case, we're going to say that she's warm and dry, skin is intact. Her chest circumference looks proportional to the rest of her body. Anything that you've noticed in the past recently that's been going on?
No.
Okay. Before getting started to my full assessment of heart and lungs, I'm just going to kind of feel around. So I'm looking for crepitus and any tactile fermentus. So first off, I'm going to have you give me a big breath. Good. Any pain with that?
No.
Good. And then I'm just going to kind of feel to make sure that there's no, what we call little Rice Krispies underneath. Very good. Okay. All right, so next I'm going to give your heart a listen to quick.
Okay.
Again, I would be doing this on bare skin. So starting, I'm going to start with the aorta and the pulmonic, and moving down to the herbs. Good. And then we're going to go to tricuspid and mitral. I'm going to re-auscultate with my belt. I'm going to have you turn just a little bit this way as you can. Aorta, pulmonic, herbs, tricuspid, and mitral. Very good. Okay. Let's see what else. I think that's about it. So since we're on the kind of task of listening and we've kind of already palpated, I'm going to just listen to your lungs right away too. Before we do that, first off, I'm just going to kind of palpate around to see if you have subclavicular nodes, and I don't feel any inflammation there. And then underneath your armpit. So let's start here and back here. Good. Any pain with that?
Nope.
Good. You've been short of breath at all lately? Coughing? Nothing like that?
Nope.
Okay. Start with listening to your lungs. Again, I would do this on bare skin. So starting with supraclavicular and the apex of the lung, both sides. Not actually listening, just. And then we'll start with the right upper lobe, the left, and up, left lower, and right lower. I'm going to actually have you turn kind of that way a little bit more,
Yep.
so I can listen to the back. A couple big breaths. breath sounds are equal. I don't hear any adventitious sounds. She says she's not been coughing, so I have no worries for brills, rhonchi. When I listened here, she didn't have any wheezing. I would go through a little bit of a respiratory health assessment to make sure the asthma wasn't on board or anything like that, but it sounded clear, no diminished and no tubular sounds. So we will move on. Really, we'll just move. Okay, so we're going to do the breast exam now. So again, for assessment purposes, we're not going to be doing anything actually by physically touching. So I'm just going to, again, walk through. So first, again, she would be without it, this would be done on bare skin. First thing I would want to do is kind of inspect, look for symmetry, look for any dimpling, nodular areas. In this case, we're going to say she's symmetrical. Any pain at all that you've experienced? Any discharge? Okay. So after inspecting, I would just go on to palpation, starting kind of from the back and on the front. If I don't feel anything here, such as lumps or extra nodule areas or their lack of, I'd have you next just kind of put your arms to your side, looking at different positions, good, and then on your hips, and then my hands behind your head, both of them, good, and then I would have her stand up and bend at the waist, all inspecting, okay. After palpation, if I have not felt anything, we would start to actually examine, and that's a little bit so soft tissue, just around, starting from here to here, here to here, and then underneath the breast, again, soft deep, palpation, and then deep. As long as there's no issues there, I would have her follow up as appropriate. But since there's not, we will move on to the next. All right, you can put your glasses back on if you'd like.
Okay.
Next, we're gonna do your abdomen. So I'm gonna actually have you lay down. Now, the difference with the abdomen is I'm actually gonna have, instead of doing inspection and palpation, I'm gonna inspect. Again, this would be on bare skin. Sorry, you can't see where you see me. Again, I'm looking for any hernias, any pulsations, any rounded distension, guarding, tenderness, anything like that. Any problems that you've been noticing lately?
No.
Okay, good. So we're gonna say for assessment purposes that her stomach is symmetrical, soft, non-distended, and without any tenderness. I don't know if I said that or not. Before palpating then, I'm gonna auscultate. Now we're making sure that bowel sounds are active, not hypo or hyper. I'm gonna start with the right upper, the left upper, left lower, and the right lower, and just go in a clockwise motion like that. And I hear bowel sounds are active, not too much and not hyper and not hypo. So at that point I would go on to palpation. Now first off, I'm just gonna kind of touch around to see. I'm gonna percuss for the liver, which is on the right here. And then the spleen. Now we can actually start to feel. I'm gonna identify where the liver is, and then the spleen. And I don't feel any masses, and I don't feel any extra inflammation. They are both identifiable. Next we'll go to the quadrants. Any pain with that?
No.
Okay. And there?
No.
Good. Here? Here?
No.
Okay, and then I would do deep palpation. And I'm not feeling anything abnormal. Good. No pain with that either?
No.
Okay. I'm going to go back, and then I'm going to also listen for the aortic artery to make sure that there's no bruise. And then we're going to move to the renals. The iliac. And the femoral. Good. Okay. If you'd like, you can sit back up. I'm going to have you just sit right at that edge again.
Okay.
Good. Now, since we're moving down the list, I'm going to just kind of go through, and we're going to do your legs. Again, I would do this on bare skin. So first I'm inspecting again for any hair distribution, extra sweating, if it's cool, if it's dry, if it's warm, the proportionality of the rest of her body, if one is bigger than the other. There is no edema. I don't see any discoloration. Again, this would be on bare skin. So we'll move on. Is there any weakness that you've been developing?
Mm-mm.
Muscles feel okay?
Yep.
Okay. So after I've inspected, I'm going to palpate and just make sure. I don't feel anything. There's no pain. Good. With my palpation, I'm just going to start to feel for pulses. So we'll start with pedal. Good. And post-tibial. Good. And popliteal. Very good. Okay. I'm just going to test for strength right away too. And I have you just push down. Good. Strength is equal. And pull up. Good. Strength is equal. Okay. So while we're doing that, I'm just going to have you kind of move around for me a little bit. I want you to just kind of wiggle your toes. And yep, perfect. Full range of motion, no pain with that. Oh, good. Let's try and have you do your knees back and forth. Good. And then I'm going to have you stand. Okay. And I just want to have you face that way once. And I'm going to have you just lift one leg and go back. So we're testing your hips, and then forward. And then a little to the side. Good. And then I'm going to have you turn the other way and do the same thing with your other leg. Good. All right. So while I was doing that, I'd make sure that she's stable and she looks stable on her feet. There's no balance issues. We're going to kind of move that way in that direction now. So you're not swaying or anything. I'm looking for imbalance or unsteadiness. I don't see any of that. Next, I'm going to have you put your arms out like this. Good. And just stand there for a second. And now close your eyes. Do you feel dizzy at all?
No.
Good. All right, I'm going to have you just lift one foot up and stay there for a second, if you can. And I'll do a couple of hops on that same foot. Good. Okay, that was good. I think that you can sit down. We can always come back if need be, but okay, go ahead and sit down.
Okay.
All right. So we're going to start with your kind of your overall neurological status here now. So we kind of already, I think I'm missing something, maybe. Okay. Let's see, I think I did actually miss something. So we're going to stand back up.
Mm-hmm.
Sorry about that.
That's
and
okay.
I'm going to have you just kind of, since you were standing before, start over here
Mm-hmm.
and take a couple of steps that way and then come back. Good. And then I'm going to have you do the same thing. Instead of just walking normally, though, I'm going to have you do a heel to toe. Just three or four steps is good. Good. All right. You can go ahead and sit back down now. We're going to kind of go through again quite a few things, but just testing mainly your neurological function. So first, let's start with your uppers. I'm going to just have you put your hands out like this and close your eyes, and I want you to tell me if I'm going up or down with your fingers.
Down. Up. Down. Up.
Good. Now with your eyes closed still, tell me if this is the sharp or dull feeling. Or soft.
Soft.
Good.
Soft.
Good.
Sharp.
Good.
Sharp.
Good. And move up. How about now?
Sharp.
Good.
Sharp.
Good. This was something soft, but it feels soft.
Yeah.
Okay. All right. I'm going to have you do this. I'm going to draw something on your hand, and I want you to tell me what you think it is. So it'll be a letter or a number.
Okay.
Okay?
Letter.
Letter. What letter?
A.
Good.
7.
Good. All right. Just keep your hands like that. I just got to grab something over here. Next, I'm going to actually have you, if I can find something, tell me what that object is.
A card.
Good.
penny or a dime.
Good, perfect. All right, you can open your eyes. All right, almost done with this. So next I'm gonna have you just put your arms out like this and touch your nose. You can keep your eyes open for that. Perfect. All right, now I'm gonna have you touch your nose and follow my finger.
Okay.
Okay, then touch my finger.
Touch your finger?
Yep. Okay, now back to your nose. And then back to my finger. And kind of alternate like that. Good. Good. All right, next I'm going to have you just do rapid movements, kind of like this with your hands. And close your eyes. Good. All right, and then same thing, I'm going to have you close your eyes and just do alternating with your fingers to your thumb, index finger. Good. Perfect. Wonderful. All right, next thing we're going to do, let me get some of this stuff off. We're going to actually do that with your arms, or sorry, with your legs as well. So again, you can stay sitting for this. I would do this on bare skin, but I want you to tell me if this is soft or
Soft.
sharp. Good. And over here.
Soft.
Good. How about this?
Sharp.
Good. And this?
Sharp.
Good. And then I would do the same up here. So for, is it best guess?
Sharp. Soft.
Good. And the other?
Soft.
Good. And last?
Sharp.
Good.
And sharp.
Good. Very good. Okay. Almost done here. Now I want you to, I'm going to do the same thing on your legs since I'm down here, but I want you to tell me if when you feel 1 point instead of 2, okay?
Okay. No.
Good. All right, the other one?
No.
Good. All right, and then I'm going to do to your palms.
Okay. No.
Okay.
No.
Good. Very good. All right, let's see. So for your legs, I'm going to have you take your heel and I'm just going to have you run it up from your knee down to your ankle, both sides. Good. And then I'm going to have you take your one leg and cross it over the other and do that with the other leg as well. Perfect. Any dizziness with that?
Nope.
Perfect. I think we're almost finished here. So next I'm just going to have to test your reflexes.
Okay.
We're going to start with your very upper extremities here again. So first we're going to do the bicep. Good. This is going to be kind of hard with this. But good. And we're going to do the tricep. Good. Good. All right, we're going to do the other one here. And we just look for hands to kind of go out like that. Here. Good. And for the tricep, there's not going to be much movement, but I am looking for flexion. You can just kind of relax your arm there. Good. All right. Next, I'm going to start with the patellar. Just a little bit below the kneecap. I'm not actually going to hit you here. But okay. Good. Intact. I'm looking for kind of a kick of the leg. Good. Achilles. Good. Good. And then plantar. So I'm going to actually support this, and then I'm going to just check there, and if you end up going down, that's what I'm looking for here. Can't really see very well, but good. Okay. I think that's all of them. Is there any other questions that you've had during this process?
No.
Okay, you did very good. Thank you so much for letting me be your nurse today, and thank you for being my patient, and thank you for your patience. Before I left, I would make sure she needed everything safety-wise. If she's in the hospital, she would have her grippy socks on, call bell, bed is to the lowest. I would wash my hands again and ask her if she'd like or prefer the curtain open or closed. And I think that's about it. Thank you for your time.